And then down at the bottom of the page is the hysterectomy. We just talked about that a minute ago. If they do a total hysterectomy, you're going to have 2 codes. One for removal of the uterus, resection of the uterus, and the other for resection of the cervix. If you see supracervical or subtotal hysterectomy, that means they only removed the uterus part and they left the cervix intact. So that would only require 1 code if it's subtotal. And remember, those are easy to remember because they're always going to start with out. Okay, on the next page, endometrial ablation. That's what we were talking about a minute ago. They're going to go in there and destroy the lining of the uterus. Okay, so what do we know about ablation? Destruction. So that would be coded out to the root operation destruction. The approach is usually via natural opening endoscopic. And the next page is about the breast. Shockingly, the neoplasms of the breast will, as with everything else, go to chapter 2, neoplasms. But they remind you that some terminology such as growth, cyst, or lump are not necessarily neoplastic disease. So don't automatically take those to cancer. In fact, remember, I think we followed lump through the other day and it went to disorder of the breast. So be careful there. When you are coding surgery of the breast, you're coding to the body system, skin and breast. Okay, and if you're doing a biopsy, you have a possibility of 2 operations, right? Could be drainage or it could be excision. I don't think they'll be doing an extraction there. Extraction's like for bone marrow. But for the breast, it could be drainage because it may be fluids, like a fluid-filled cyst that they're going in and testing to see if it's malignant, or it could be a mass or a lump, which would be excision. And remember, if it's a biopsy, the qualifier is X to show it's diagnostic. Then this is where they remind you about the terminology excisional biopsy. Remember, sometimes when they do the surgery, they're actually doing a lumpectomy and they're taking the entire lesion, and that is not a biopsy, even though we both know that they're going to send it to path and find out if it's malignant. It's not. Remember, a biopsy means they took a portion of the lesion. So it would still code out as an excision, but you wouldn't have the qualifier X because they removed the whole lesion. It reminds you that if they do a biopsy before a mastectomy, that you're going to code both. Which one's going to go first? The mastectomy. Why? Because what?
Well, it's the most resource intensive.
The definitive.
It's the definitive. Close. That'd be next. Okay, that's the third one. So the first is that the biopsy was diagnostic. The mastectomy is done to fix the problem. So the mastectomy would be first and then the biopsy. But both are coded. Okay. Then it tells you the difference between a radical mastectomy and a modified radical mastectomy. So in a radical mastectomy, they take all of the pectoralis minor and a portion or all of the pectoralis major. Whereas if they're doing a modified radical mastectomy, they just take the pectoralis minor, but the pectoralis major is intact. They don't remove any of it. Okay? And that makes a difference in the number of codes you assign. So if they're doing a radical mastectomy, it takes 3 codes. Okay. It takes 1 for resection of the breast, 1 for resection of the axillary lymphatics, so they're taking those lymph nodes, and then the third one is for the left thorax muscle. So that's going to be that pectoralis major. Okay. Whereas when they do the modified radical, it only takes the 2 codes, the one for the breast and the one for the axillary lymphatics. because they leave that pectoralis major intact. There's no code for the thorax muscle. And then they talk about a skin-sparing mastectomy, which is, again, you're going to code the resection of the breast. And I would be very surprised if they didn't remove lymph nodes, but it didn't talk about that, so I would just look at my operative report and see if the lymph nodes were removed. What it does say is that you don't have to code the nipple resection, but that's included in that. And then it also talks about inserting a tissue expander. You know, that's for the reconstruction. So they're going in there and they're trying to stretch that skin so that they can use it for the reconstruction. So they'll put in this like a balloon type thing, and then periodically they fill it with more fluid and stretch that skin. So that codes out to insertion of a device, and the device would be N, the value N for tissue expander. And of course that's going into the breast. So. Next page is talking about breast reconstruction.